or rent in town. You're sure to find the right fit at Mobility at Home. We make everyday life accessible.
Good morning. So nice to have you join us on yet another beautiful day here in the Tennessee Valley. As you well know, if you watch this show on a regular basis, we're always highlighting the benefits of living here, the beauty of it, the businesses that are here, the community activities that are going on here. It is a thriving, vibrant place to live. But sometimes we also need to point out to you some of the risks perhaps associated with this part of the country and where we live. And one of those happens to be that we are in what is called the stroke belt. Perhaps you have heard that before. No one knows that better than Dr. Tom Devlin, who is the medical director at CHI Memorial Stroke and Neuroscience Center, and he joins us this morning. So good to talk to you as always.
Good morning.
You and I met for the first time, I don't know, maybe 10 or 11 years ago, and I was struck immediately by the passion that you bring to your gift to help people. And you see this as not just your own, but the hospital itself is behind saving people's lives quite literally.
Absolutely, and thanks for talking about this very important topic. You know, Julie, this is National Stroke Awareness Month, and there is no area in the country that this is more important to than right here in the Chattanooga region. You know, stroke is the number one cause of adult disability, the number one reason why someone's in a nursing home throughout the entire United States and throughout the entire world. And here in Chattanooga, we are right in the middle of what's called the stroke belt. We have the highest incidence of stroke anywhere in the United States. Very important that we just remember a couple simple things. Number one, what are the signs and symptoms of stroke? Keep in mind, stroke can affect anybody at any time, at any age. It's not just an old person's disease. We see people in their 40s, 30s, sometimes even younger with a stroke. So know the signs and symptoms. And it's really very simple. Just remember the word fast. If there is F for facial weakness, a sudden onset of drooping of the face. Number two, arm weakness, such as when you try to raise your arms up, you're just real weak on one side of the body. And oftentimes it'll be face and arm, or arm and leg, or face, arm, and leg, but it often affects the arm. So arm is the A in fast. And the S in fast is speech, either slurred speech or difficulty getting your words out. So face, arm, or speech problems. And the T is to remind you that time is brain. T for time. And what should you do? You should do one thing. It's not call me. It's not call your mother. It's not call your son. It's call 911.
Let me ask you something on the time side of it, because you've been very good to provide us with a few facts to back us up. One fact I'm reading is that every 40 seconds in the country, someone is having a stroke. That's a huge number. So what's causing it, Dr. Devlin? What causes a stroke?
Absolutely, and that's, you know, the most important thing I like to tell my patients is that 80% of strokes are preventable if you control your risk factors. And those risk factors are blood pressure, number one, obesity, weight, number two, smoking, diabetes, your diet and your cholesterol are the main ones. And then we have some other risk factors such as sleep apnea. People that snore may have an interruption in their breathing at night, may drop their oxygen level. We know that is a cause of stroke as well. So the point here is see your doctor regularly, control your risk factors, high blood pressure, high cholesterol, smoking, your weight, treat your sleep apnea. Keep in mind the majority of those are under your control. There are genetic factors as well that you cannot control. But the majority of stroke is due to poorly controlled risk factors. You need to see your doctor. It's a whole lot easier to prevent it than it is to take care of it if it happens. So really work an 80% of those cases of stroke actually could be prevented.
I'm sorry, is a stroke a blood clot essentially that goes to your brain?
Exactly right, and that can be either a blood clot that forms within the brain, or it can be a clot that, say, starts in your heart or your neck and goes up to the brain. So there's many different causes of stroke, but at the end of the day, the key thing is that the brain is unable to store any energy whatsoever. It relies minute to minute, second to second, on blood getting to the brain to carry oxygen and to carry sugar. That's what keeps the brain cells alive. Okay. And as soon as there's an interruption due to a blood clot in the brain cells start dying. And for a larger stroke, they die at an alarming rate, Julie. They die at a rate of 120 million brain cells an hour. That's 447 miles of brain fiber an hour. So the faster you call 911, the quicker you will come to our attention, and we can treat you with either life-saving clot-busting medicine or the amazing clot-grabbing procedures that we do in this room here, a very advanced room, where we very simply, we don't have to open up your head at all. We just go through a little artery in your leg, go right up into the brain, and grab the clot and pull it out. But you've got to get here quickly.
Okay, so I mentioned how you and I first met 10 or 11 years ago, and at that time we were at an event for brain injury, which you often see as a result of a stroke. So this center where you are this morning is going to open officially the month of June, but the whole purpose of it is that it's now 24/7 access, am I right, to this cutting edge abilities?
Absolutely. There is no hospital in the world that will be able to provide more treatment than we are able to offer here. And we don't say that lightly. We don't just say that's all that we can do. We can say that is all that can be done anywhere in the world. And by that, we also mean the clinical trials. So we have clot-busting medicine. We have very advanced treatment where we have built-in CAT scanners and CT angiography, what's called CT perfusion, the ability to see what area of the brain is dead, what area of the brain is going to be dead if we don't get it out. And that is all built into the angio table. So the whole approach here in patients coming in with a large stroke is to bypass the ER, bypass all the CAT scanners, come straight to the angio table, do all the advanced imaging that can only be done on a very high-end, state-of-the-art technology like this, and then get the clot removed. Okay. But in addition, we have a whole variety of other clinical trial options with new drugs, for example, that could be given up to 24 hours after onset of the stroke as clot-busting drugs. We have stem cell therapies that can be given up to a couple days after the stroke, and these are under a variety of research protocols. But keep in mind, what is today's research is tomorrow's breakthrough medical technologies and improved therapies.
I only have a couple of minutes left, and I promise I know you've got to go see patients, but two quick questions. One, on the smoking side of things, I know that's a daunting a piece of advice for a smoker to hear is to quit smoking. So even if you can reduce the amount of cigarettes that you're smoking, does that help you a little bit?
Absolutely. Any smoking at all actually increases your risk of heart disease, lung cancer, and stroke. But anything that you can do, and seeing your doctor, smoking is one of the hardest things to give up. And but we have a lot of different ways we can help you with medicines and all sorts of counseling, a lot of different things that can actually take away and assuage that real sense of a desire to get that cigarette. So your primary care doctors can really help a lot with that.
The data might not be there yet, so sorry for the question, but is vaping a concern?
Vaping is a concern. Vaping is a definite concern. Vaping has been shown not to be particularly healthy and definitely can increase the risk. So, and we see a lot of vaping in young people, so vaping is a concern to us. The other thing that we see, particularly here in the South, is obesity, and we see it in our children. We have one of the highest obesity rates in our young children, and we know that can begin to form all the plaque and all the disease in the brain, starting really within the teenage years. So vaping, obesity, smoking, These are the things that set the stage in the teenage years for more problems to come. It's why we have the highest incidence of stroke anywhere in the United States, right here in our Chattanooga region.
Dr. Tom Devlin, I know you got to get on with your day. I feel like I should give you my insurance card and give you a copay. Thank you so much for the time this morning.
Thank you very much.
So watch for more about the news of that center that he's talking to us from today, opening for you. It will become a 24/7 access to this latest technology that he was talking about. In the meantime, you can always give them a call, 206-4140, and learn more at memorial.org/stroke. We're back after this.